So this joint is incomplex joint. So some structures surrounding the joint should provide the stability. So the basic or primary stabilizing structure for the sternoclavicular joint is your sternoclavicular disc. Okay. So what is the function of disc? The function of disc is to provide stability and it also provides the competency towards your joint. You will see the sternoclavicular disc attachments in detail. So this is your sternoclavicular disc. In the disc you can see it will be having the upper attachment and it will be having a lower attachment. So the upper attachment, it is attached to your upper superior portion of your clavicle, and the lower attachment, it is again divided into two types, two attachments. So one is going towards your nodes of your manubrium and other is going towards your costal cartilage. Okay. So you can see the upper attachment, posterior superior surface of your clavicle, lower attachment to the manubrium and your first costal cartilage. So here you can see the figure. So this is the sternoclavicular disc. In the disc you can see the upper attachment is only to the superior and posterior part of your clavicle, and lower attachment, it has two attachments. One is towards your manubrium and other is towards your first costal cartilage. So here you can see the function of your sternoclavicular disc. So the basic function of your sternoclavicular disc is to provide stability. Okay, so it provides stability. How it provides the stability? By improving the congruency of the joint. The disc will improve or it enhances the congruency. So what happens when the congruency of the joint is increased? The translatory force acting over the joint will be restricted. Okay, so this type of diagonal attachment will help to prevent the medial translation of your clavicle. Okay, so it also acts shock absorber. So what is shock absorber? Shock absorber is nothing but it will absorb and transmit the forces from the joint to the other part of your joint. So when a laterally directed force is acting over your joint, from the lateral end of your clavicle, it will be transmitted to your medial end, then it will be transmitted to your axial skeleton by your sternoclavicular disc. So all these are the function of your sternoclavicular disc. So it provides stability, it prevents the medial transmission of the clavicle, and it acts as shock absorber. Now we are going to see other structures that is providing the stability to your sternoclavicular joint, that is your capsule, then the ligaments. So basically there is three important ligaments that is providing the stability to the joint. So from the name only you can see there is sternoclavicular ligament, then there is costoclavicular ligament, then there is interclavicular ligament. So sternoclavicular ligament, it is both in the anterior aspect as well as in the posterior aspect. Then costoclavicular ligament, it is also there in the anterior aspect or as well as the posterior aspect. The interclavicular ligament, that is the ligament that is connecting your both the clavicle together. Now we will see the structure of this ligament, so you will understand better. So this is the structure of your costoclavicular ligament, interclavicular ligament and the sternoclavicular ligament. So this yellow portion is this ligament is called as interclavicular. Why it is called as interclavicular? Because it is connecting both your clavicle. Then you have your sternoclavicular ligament that is connecting your sternum to your clavicle. Then you have the costoclavicular ligament. So this is the ligament that is connecting your clavicle to the costal cartilage. So these are the ligaments that is supporting your sternoclavicular joint. So what are the function of the ligament? To prevent the forces acting over the joint, and it will prevent the translation occurring across the joint. So these are the structures that will provide the stability to the joint. So what are the structures that provide the stability to the sternoclavicular joint? So basically you have the sternoclavicular disc, and then you have the capsule, then you have the most important ligaments, that is your interclavicular, sternoclavicular and costoclavicular ligament. So these all structures provide the stability towards the joint. So in next class we will learn about the functions and movements of the joint. Okay, thank you for listening.